Hello everyone! Our video today is about a very interesting topic, but yet a controversial one. Have you ever heard about Oriental medicine? You may sometimes see athletes with purple circles on their skin or their back from cupping. Or maybe you know someone who tried acupuncture and swears by them for their back pain. Or maybe you heard someone telling you that their herbal tea cured their cold. So what is that? What is Oriental medicine? Today we are going to talk about Oriental medicine. Our role today is to answer most of your questions regarding Oriental medicine. Today we have Dr. Lee, who is leading doctor at Nasaret Hospital in Incheon. He is going to discuss with us everything about Oriental medicine from an experienced medical point of view. I'm Ume, and before we start, please subscribe to our channel so the next time you'll be informed with our new releases. Hello, Dr. E. Nice to meet you.
Nice to meet you.
Okay, so we're here today to talk about epilepsy. Can you please explain what is epilepsy and how do you treat it in the Oriental medicine?
Epilepsy can happen due to a variety of reasons, but young kids tend to be more prone to it, albeit there are adults with the condition. Many visit me with brain issues such as trauma or inflammation. Their heads tend to itch.
So what is the success rate of epilepsy when using Oriental medicine?
Epilepsy treatment in Oriental medicine is done usually with acupuncture and cupping. Also, Oriental herbs. Western medicine does not understand the role of acupuncture and cupping. In Oriental medicine, acupuncture and cupping raises one's energy levels. Through the method of re-energizing, the affected nerves revive and come back to life. In modern medicine, there is no way to revive. In Oriental medicine, we can use acupuncture, cupping, and herbs to revive the nerves.
So do we use new drugs and Oriental medicine together to treat the epilepsy?
We can use Oriental medicine methods such as acupuncture and cupping with modern medicine. But modern medicine does not seem to work in curing the illness. Perhaps it is just a treatment for symptoms.
So for women who are pregnant and young people who have epilepsy, they can also get Oriental medicine?
Yes, it is okay to get treated with Oriental medicine. It is okay to take Oriental medicine herbs too. Oriental medicine does not harm the body.
So a patient can be fully recovered just by using Oriental medicine?
The results are excellent. When I treated with acupuncture, cupping, and herbs, epilepsy patients have a 90% success rate in fixing the issue.
So for a brain stroke, can it also have positive effects using Oriental medicine?
There are three types of strokes: ischemic stroke, hemorrhagic stroke, and transient ischemic stroke. As a result of stroke, a side effect can happen in which the body can become paralyzed. It can affect the lower body or impede swallowing. They can also be paralyzed from speech, also facial paralysis. In Oriental medicine, we treat these symptoms with acupuncture, cupping, and herbs. We treat the affected nerves this way.
So when is a good time for a patient with a brain stroke to undergo Oriental medicine?
Stroke should be treated right away. When treated right away with Oriental medicine, there are very few side effects. It is important to reduce side effects, and it is possible when treating quickly after an incident. The treatment effect is better when done promptly.
So after being treated with Oriental medicine, is it possible that the stroke reoccur?
Reoccurrence is rare. It can happen, but it is rare.
So let's talk about obesity. What is obesity and how is it dangerous on somebody's health?
Obesity is when someone is relatively too heavy. Normally, body weights are calculated by multiplying one's height. For example, someone who is 1.7 meters tall multiplied by itself, and 21 for women and 22 for men. The result is the normal weight. So if someone is above the normal range, he or she should pay attention to reduce weight. If you're within the range, then you are not obese. If one is obese, he or she is prone to getting diabetes or high blood pressure, high cholesterol. These illnesses block the blood-flowing veins. Obesity has to be controlled.
So for treating obesity, what kind of Oriental medicine can be used?
There is an Oriental medicine for that purpose. If one takes Oriental medicine, it works. In 1 month, 2 to 3 kilograms can be lost. So depending on your current weight, one can calculate how long it takes to take the Oriental medicine to achieve the goal. So if one wants to lose 10 kilograms, the course would be about 3 months.
When undergoing Oriental medicine treatment, is it also possible to work out and go on a diet?
If it is combined with exercise, it is great. Combining exercise and eating well together with Oriental medicine is good.
So Oriental medicine, it helps with obesity, but does it also help with the other diseases that are related to obesity?
High blood pressure or diabetes are treated automatically once obesity is controlled. Diseases like high blood pressure and diabetes can be solved once obesity is taken care of.
네, 알겠습니다. Thank you so much, doctor. 감사합니다. Today we learned many things about how Oriental medicine treats diseases and how to relieve symptoms. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.